Hello, everyone, and welcome to Revitalize Podcast with me, your host, Dr. Debra Durst, and my co-host.
Hey guys, Verity Golombieski here, nurse practitioner at RevitalyzeMD. And this is going to be one of my favorite podcasts.
I know we love talking about sexual wellness and how we can help women in sexual health and wellness.
I feel like most of the women we see in the office are very distraught by the answers they're getting from primary care. Mm-hmm. And they're all looking for answers and they don't know where else to go and they feel helpless. And I love being able to empower women to fix some of these really easy conditions that we have wonderful treatments to help with.
Well, and over the years, what's happened is like you get women that come in and they're just tearful at the end of an office visit, the first office visit and the consult, because finally they feel like they've been listened to. And that happens over and over again. In fact, when Faraday first came on, she had worked with men a little bit more than women at the time and was just, surprised by the reactions.
Yeah, I think my question was, do they all cry?
Yeah. Yeah, because like it's
I was surprised.
Shocking. Yeah. It's shocking because you just don't know how frustrated they are by not being listened to. Absolutely. By their primary care doctors, by their GYN doctors. So it didn't take long for this wonderful woman to get used to it. And she's very comforting. But again, it's just women have went for years being
they feel unheard, ignored. They've exhausted all of their efforts. Mm-hmm. And like Dr. Durst said, they finally feel heard. They feel like their concerns are validated, that they're not alone. And there are treatments and there are a lot of different treatments. And that's why this is one of my favorite podcasts, because we get to talk about women's health and female sexual wellness.
Yes. And so again, some people will come in based on symptoms of like almost hormone deficiency or not optimal hormones. So like low energy, brain fog, low sex drive. And then we open the door to, sexual wellness as well. But then some women will come in with complaints of something related to sexual wellness. And then we're talking about hormones. But today we're going to focus mainly on not the hormone optimization, but really local regeneration of tissues for female sexual wellness.
But if you want to hear more about hormones, we have a lot of podcasts on that as well.
We do. And definitely remember to like and subscribe, and we'll remind you again at the end. We really appreciate you following along and listening. And please subscribe, share with friends so that we can get the word out there for women. So basically, we're going to talk about regeneration of tissue. So like, again, what has the FDA approved over the years really is drugs and surgery. And so we have very common, very simple complaints, and regeneration of tissue is the best way to get improvement in symptoms. And so we're going to go through lots of different treatments we have. And we have a very comprehensive array of treatments with this that have continued to expand over the last couple months.
We have something for just about everybody now. We have a full suite of women's wellness and health.
And we thought we had it before.
We did.
Yeah.
And we were doing well. And then, new things come out and it's like, ooh.
Well, and it's amazing to me how this field has changed over 2 years.
Oh, absolutely.
Like, again, I would go and speak and trainings, different places, and no one would talk about it. It was like completely unheard of. And now, most recently, we added a platform that has a lot of different modalities for female sexual wellness and health. And so we're excited to expand our services even further than we had before.
Absolutely. So we have stuff for internal health and external health, and then things that do both. So we'll kind of break them down by...
We'll start with internal first. Yeah. Internal is always a good. So again, when we mean internal, we're talking about the vaginal canal, so basically, everything, we all have changes as we age. And so men will have different changes than women. And for women, frequently because of childbirth, the way to childbirth, we have some urinary incontinence. We have vaginal laxity or looseness, so we're not as tight as we used to be, decreased orgasmic strength, dryness, sometimes pain with sex. And so very common complaints internally.
And urinary incontinence.
Yeah. And urinary incontinence, jumping on the trampoline.
Sneezing, coughing,
and leaking urine. Very common. And so ladies, you're not alone. If you've had a pregnancy, not necessarily even just childbirth, just the weight of the pregnancy alone can cause those symptoms. or not vaginal deliveries, I mean, but vaginal deliveries, it's even more common.
Absolutely.
So the internal treatments functionally improve and regenerate tissue. And so the first one we'll talk about is Votiva.
Our tried and true, one of our favorites, an oldie but goodie.
I know. Well, we love it. And for years, that's what we offered along with the O-Shot. Those were our go-to. We even got a little confused as we started to add a lot more that we can do as far as the internal treatments.
Absolutely. In the beginning, I'm like, but should we just go back to Votiva?
Yeah.
Until we started doing them and seeing, okay, so there are some treatments that are going to do something better, right?
Yes.
So again, by expanding the technologies that we offer here, we're able to be more comprehensive. So while we love Votiva, it has its place, just like all the other treatments do.
And when we talk about the different treatments, like Votiva, all of our treatments internally are non-ablative, which means it's not going to take off a layer of tissue. You don't have downtime. And to me, I feel like I'm not sure how many times you can ablate and it be safe. So just heating tissue and telling it it's injured so that it can repair itself is the best way. And that's really what we're doing with all of our internal treatments. Votiva uses radiofrequency heat. So we're basically using a probe inside the vaginal canal to just heat tissue until it's injured
and to create more collagen.
Yeah.
Right? Because that's essentially what we want to do, is to bring stem cells to the area, build collagen and elastin, and help repair that vaginal tissue.
And so you get tightness and contraction, and a lot of ladies will feel that on their first treatment.
Yeah.
And so they'll already feel.
With increased blood flow, we get better orgasm strength internal. We also get better lubrication.
Lubrication is a form of or a function of blood flow.
Absolutely.
So if we're improving blood vessel health and blood flow to the vaginal canal, then you're going to get increased lubrication, less dryness, less pain, all of that. And again, it's just a heating probe using radiofrequency heat. So it's very safe. Minimal downtime, no discomfort, a very short treatment.
Really, the only big contraindications is an internal device, depending on that device.
And where it's located.
And where it's located would determine on whether or not you'd be a candidate for treatment. So it can be used for a vast number of women. So this one has a very minimal requirements that would knock somebody out from using it and benefiting from it, which is great. I know we're talking about internal, but a lot of these treatments can do internal and external. So Votiva is one of those that can also do external treatment, which we can talk more about as well. But I think it's good to note that as we're going through, because a lot of these lasers do double duty.
Oh, yeah. No, in fact, our internal ones, 2 of them, really, you can come to the outside. Aesthetically, we probably now have moved to something that's better on the outside. But as far as just hitting the clitoral, bringing stem cells to the area by heating is awesome for these internal and external devices. So.
Exactly. So helping that blood flow to the clitoris to help with orgasm strength. And then also there is some tightening effect with heat. But there are some devices now that just do better aesthetically. And we'll get into those as we go into those external.
And in fact, we're very excited about those results. So we'll move on to that one. But Votiva, again, has been our staple. It's been our go-to. We've used it for years and paired it with the O-Shot, which we'll talk about. But basically, when we're talking about these internal devices, they're heating, telling the tissue it's injured to get repair. And then with the O-Shot, as we get there, we're basically dumping in a bunch of growth factors to further stimulate repair. And so they work really well in combination for all of what we talked about: lubrication, dryness improvement, orgasmic strength, tightness, urinary incontinence, all of it.
All of the things.
All the things. So then if we move to, well, let's go to Fotona, because it's slightly different.
Yes.
Because it doesn't do the external the same way as the others do. So Morpheus V is a recent addition to our treatments for internal, and therefore, like Faraday was saying, external as well. And so this one will be interesting because we added it, but I had to see it
to believe it.
Action to believe it. So because if you've ever had a Morpheus treatment in the skin, face, neck, chest, it can be a little uncomfortable.
Or body, because now we can do Morpheus microneedling of the body as well.
Yeah, it can be a little uncomfortable. Again, it doesn't have to be. There's many different ways that we can make that comfortable. There's medication we can administer in the office. There's laughing gas and Pronox. There's local anesthetics, blocks, everything we can do. But again, it's kind of an intimidating procedure despite all the attempts at
exactly. So when we talked about Morpheus V, so microneedling internal vaginally, and the rep that was a male said, it's not painful. I was like,
yeah,
interesting. Yeah. Because it is for the face.
Yeah.
How is that so?
I didn't believe it. Like Morpheus on the face, neck, chest, body is one of my favorite treatments, but I do. Yeah, but I'm not going to lie. It can be uncomfortable, and we have improved significantly in how we manage that discomfort.
Yes, manageable, but uncomfortable.
But then I thought the vaginal and microneedling inside the vaginal canal, I didn't believe it to be painless until we did it. And so, saw it my first training. When I saw it in another office, I was shocked as the lady was sitting there just talking away, didn't even use the Pronox and laughing gas.
Just chit-chatted.
Like she was having nothing done. But we have had that experience consistently across the board at our office as well. So it is comfortable.
Safe, effective, and non-painful. Let's stress that. It's microneedling of the vaginal canal. That's non-painful. I never would have thought that ever.
No.
Literally, I would cringe when anybody would bring it up and talk about Kegling, right? Everything tight and ugh.
Oh yeah.
But
talk about good Kegels when we would just talk about Morpheus V.
Exactly.
But so I think number one, we do have again a topical and kind of a product that we use. At some point, we'll do a podcast on that. A product that we use that kind of increases oxygen and blood flow to get the numbing medicine vaginally to work better. So we've added those. Again, I'm not convinced that if we only did topical that we wouldn't have the same response as far as pain, because nobody has had discomfort. But I think that my theory is still, I haven't proven it yet. But
it's a good theory.
Yeah. Is that the vaginal canal is meant for blunt forces and not needles. And so I just think that, it doesn't sense sharp. But anyhow, it is comfortable. The issue is, why would we use Morpheus V over Votiva? And really, if you have more severe urinary incontinence, where you're almost approaching, something that really needs to be probably surgically addressed if you weren't able to regenerate, then you're looking at Morpheus V for sure.
So we're talking about still using that radio frequency. So still using energy and heat to tell the tissue that there is damage, but now we're adding microneedling. So now we're penetrating that tissue with that energy and heat, so we're able to get a better remodeling response.
If you think about, so Forma is an aesthetic treatment, and Votiva is similar to that. If we used Forma on the face, it's heating with radio frequency to stimulate collagen elastin, but it stays on the outside, and Votiva stays on the outside, doesn't penetrate the tissue. Where if you do a Morpheus microneedling on the face, you're using the needles and penetrating the radio frequency energy into the skin, driving the energy in. And the same thing with the Morpheus V, like Faraday said. So now you're penetrating, driving the energy in. So, it's going to treat more severe conditions. And so if you have more severity as far as laxity, really, or urinary incontinence is where we're targeting Morpheus for sure over Votiva. And of course, if somebody is nervous about getting the Morpheus V, then that would be another reason to go with Votiva. Both great options.
So we can get great tightening with this as well. And then whenever we're building collagen and elastin and helping with remodeling, we're helping blood flow. So again, that lubrication, helping with orgasmic strength as well. So anytime we get blood flow, right, all we're doing is helping that tissue and remodeling that tissue and getting better results for our patients across the board. But Morpheus V is one that we would go to more for very severe stress incontinence, and that needed had more laxity than somebody with Votiva. That had a little bit more going on, that needed something a little bit more strengthening.
Yeah, and just remember, whenever we're increasing blood flow, we're also increasing sensitivity and nerve regeneration. So orgasmic strength is something that we'll see increase with all these treatments, but you're not going to find that as an FDA statement or a company statement, because it's geared towards things that used to be treated with medications or surgery, and orgasmic issues have never been addressed yet in the traditional medical arena. So that's something that we see, but not something that you will find support of. But every patient that's had it, if you talk to them, it's a result that happens. So.
And a lot of these treatments are FDA cleared. So there is some FDA acceptance of these treatments as well. I know that is always a question for some of our patients.
Yeah. Well, and that's the nice thing about it. So I think like maybe 2017, right around there, they came out with something saying vaginal rejuvenation, laser and heating devices were not safe, but it was because they had not been evaluated much. And now they are FDA clearing these devices for, again, urinary incontinence, vaginal dryness, tightening, but not yet for orgasmic reasons alone.
But they're at least acknowledging the fact that it needs to happen. More research is needed, and that we need to look into it.
And that they're safe.
That's
really what you want to know, is that they're safe. And so, yeah, absolutely. So that's what we're kind of doing along with, a lot of these treatments, is kind of gathering information for the companies as well, so that we can have more information and some scientific support of what we're doing from an orgasmic sexual wellness reason. So then we're talking about Fatonagyn as a third treatment, because again, we have a pretty comprehensive array of treatments, but Fatonagyn is using an erbium to heat the tissue. And so basically it's just slightly different. You have like a speculum that goes in and stays in, and the robotic arm goes in and out to heat the tissue till it's injured, and do the same thing, but it's mainly an internal treatment and not it is an external, but a different treatment for the outside.
So Fatona, like the Votiva, is very similar in what they're doing, using that radiofrequency heat internal to tell the tissue that there's damage, to promote that collagen elastin. So those are both treatments that are very similar. Again, have similar outcomes, but used for different patients.
Correct.
Fatona does also have an external treatment that we'll talk about that differs significantly from the Votiva external treatment.
Correct.
So that's where we would go, okay, well, we want that internal treatment, but for this patient,
because we choose
this because of the external reasons. And depending on what our external needs are, would determine what Dr. Durst and I decide would be best for that patient. So that's what's really nice. This is not a one treatment fits all. There's a lot of offices that people go to.
Customized to the patient, their needs.
Exactly.
The results that they want. I will say we've talked a lot about radiofrequency, but just a minor correction, not that it matters from a layman's standpoint, but erbium is the heat used for Fatona versus radiofrequency. So it's an erbium heating, which is we've like done so much radiofrequency now that it's like
it just rolls off the tongue.
I know we almost think about it all the time with it, but it's the same thing. It's a heating device. It's just a different form. So it's actually officially a laser. But when we're talking about that external, now that we were at the Fatonagyn, which is an internal treatment, and what Faraday was talking about is this amazing external treatment you can do with Fatona as well. You want to tell them about that?
So it is, as Marissa has talked about, our esthetician on multiple podcasts, the 4 minutes to your best foreplay. So it is a clitoral stimulation. So again, using that erbium laser on a different mode, a little bit more fine-tuned to bring stem cells to the clitoris, and clitoral head, and to improve blood flow. And that is it works so well for our patients.
Oh, yeah.
It is unbelievable, the response that we get for such a quick and easy treatment that is non-painful, has no downtime, and we can add it on to any of our Fatona treatments extremely easily, because it's just changing out a handpiece.
Yeah. And we have done that, and that's why it's become so popular. We have added it on to multiple like Votiva treatments and packages, and they love it and come back in and just want the Fatona clitoral treatment. And so again, that's a very short treatment that can be added on to any of our treatments. But then if we're already so if we think externally, you need to have more tightening of the labia. I used to think Votiva did a good job with that. until I saw the Fatona 4V. So we do a 4D facelift, which is a non-surgical facelift with that laser, but now you can do a vaginal facelift. And so the results are amazing.
I mean, even one treatment, we have been blown away. It is a series of treatments. We do recommend doing more than one, but even the results we're getting just from one treatment. So just improving laxity around the introitus of the whole exterior vulva of the vagina. All of it is unbelievable what we're seeing with the labia change and tighten and just really improving that laxity and atrophy of the tissue. It's been pretty impressive.
Like quite impressive. I had no idea we were going to get these results, but they are amazing. So, you know, again, it's done in a series of 3. We've had some people that have done one, especially when traveling and, you know, coming into town for treatments with just amazing results. And so we'll do some before and afters at the end of this video or somewhere in here. If you're watching a YouTube, and if you're not watching YouTube, I would refer you to watch a YouTube video as well and subscribe because you can see them instead. And so just amazing treatments. The labia minora and majora are tight, lighter, brighter. It's amazing. So it is euthanizing too.
I love that you brought up brighter because we can always brighten as well. So what's great with this Fatona laser is that it's just like 170 or something plus treatments. So when it comes down to what we can do for vaginal health, we have lots of options. And one of those things is that we can brighten.
Yeah.
Right. I mean, so we can not only tighten it, we can lighten it, brighten it. All the things.
Yeah. So again, we had somebody recently that, again, it was an out-of-towner that did like the internal and the external. And, you know, 2 hours later, a brand new woman traveling back, you know, so it's amazing what you can do. And again, that Fatona, you're right. You know, you can do the internal, you can come and do a clitoral stimulation, you can do the external tightening and
for a more aesthetic.
Yeah.
Look.
And I just never even thought that vaginal facelifts, you know, aesthetically, you know, improved labia minoris and majoris without surgery. I just really never thought you could do it. And so this is extremely exciting for our office to be offering that.
Now, another external would be our Votiva, but I would consider that a step down from this treatment. So not as tightening, you still get that radiofrequency heat telling the tissue that there's damage to help increase blood flow, so it can help with orgasmic strength. It is not as focused of a clitoral treatment as the clitoral stimulation treatment with Fatona, but there is some benefit there. But it is more of a, when we're doing that internal with Votiva, we're doing that external as part of that treatment. You're going to have some tightening, just nothing near what you would get with the 4V.
I used to think they were really good.
Until
I saw the 4V, just saying that there's a big difference. And so, but I think from the clitoral stimulation, again, the clitoral head, we do have like a clitoral, clitoral little device that we can always show. But anyhow, there's a head to it and legs. And so you can hit all that with heating with Votiva. And you can actually do Morpheus-V on the outside too for tightening. And again, but nothing as immediate and as good as the 4V.
And Morpheus 8V, for the microneedling external, is great and has its place, but we typically pair that with another treatment that is a little bit more, I would call invasive, a little bit more for severe laxity that we reserve for those special patients that are looking at labiaplasty.
Yeah, so if you're looking at a surgery and you've been told, so that's a patient that's actually had issues, concerns, and has been told by the OBGYN that they need surgery to improve their labial concerns. With that, there is a more advanced treatment called a Viva that, again, it's a minimally invasive because you do use a probe underneath. So it's really reserved for more severe and specialized cases that really have been recommended to do surgery and would prefer not to. So it's not one of our usual, it's somebody actually looking for non-surgical labiaplasty.
Exactly. So those are our women that come in and say there's pinching with the tissue there. They've got a lot of laxity and atrophy, and again, are looking at labiaplasty but do not want to do surgery. So this is an option for those women where we can see some reduction, maybe not as great, right, as what we would see with surgery, because it's not surgery. We are not excising any of the skin. We're not getting rid of anything. But it does very well in helping reduce some of that extra skin and tighten.
And of course, with that treatment, we go internally too. So it's a one treatment. It's pretty, it's a longer treatment in the office, a longer downtime, because again, it's a non-surgical option for a surgical condition. And then we do internal treatment at the same time.
And again, they do say it's minimally invasive. It's just more invasive of our other options here in office.
Correct. Yeah.
But it is still done in office with local.
Well, and just so that you know that those are options, like we do, we have the most comprehensive, array of services for female sexual wellness, and we love offering all of it. It's just that some are definitely more advanced and not necessary as our everyday, treatment packages. And so, but they're available. Then the O shot too. So just so you know, that O shot we recommend with all of these treatments, because essentially if you're doing internal and you are rejuvenating the vaginal canal, then you want to add an O shot to it. And O shot, we're drawing your blood, spinning it down, getting the platelets. Platelets have growth factors in them, and then we're re-injecting them into tissue to get regeneration.
And you can add an O shot onto any of these treatments, which is lovely, because it's not something you have to make as a separate appointment necessarily. It could just be built into any one of these treatment packages.
Yes, and we do love the O shot. So, and again, one of the last and favorite, and I'll let Faraday talk about this because she loves the V-tone. And
I do love the V-tone.
She loves the V-tone, and she can get way higher in energy on the V-tone than I can. So
if I'm doing it, I'm getting after it.
She's the queen.
It has an energy of 50 for a reason. Someone's got to reach that energy level.
No, well, I've always said that until the V-tone. I'm like, there's a reason why there's 100 on the device or whatever it is as the max. But this one, I can't get past 11. But she wants to eventually crack a nut. So
look, I'm not peeing when I jump on a trampoline anymore.
No.
I mean, after 2 kids and both my girls in gymnastics and flipping and jumping and cartwheeling and all the things, and they want mom out there with them, I'm not having any issues. So that's why I love it. But again, it's another one like O shot that should be pairing with something. It shouldn't be done just by itself necessarily.
I think you're really just looking to crack the nut.
Then there's that too. Goals, right?
Yeah, goals, life goals, vaginal goals. So, but this one is EMS specifically for the pelvic muscles, and the only FDA, again, cleared. For pelvic muscle floor weakening. And so
absolutely
an awesome treatment.
So it is Kegel on steroids. So we can only Kegel to a point of fatigue. This device can Kegel us past that point of fatigue so that we are really strengthening those muscles, and it works.
Oh yeah, no, it works.
And it works very well.
So if you have urinary incontinence, we recommend this being paired with any of our internal treatment devices. And so this is something that you can do it as an ongoing, treatment as well after you do the series of 6. And so this is something, if you have urinary incontinence, definitely you want to pair this.
Just trust me, it's worth it.
No, she loves this one. So, but anyhow, so that kind of sums up really just about all we do. And again, if somebody's coming in for more hormone related complaints, we're always addressing the sexual wellness issues that come along with that. And then if someone comes with sexual wellness complaints, we're kind of at least evaluating, we are evaluating their hormones as well to make sure that they get sustained results with any treatments that they're going to do. So if you have any questions about any of these treatments, please drop us a comment. Let us know what you want to hear more about.
Yep.
Give us any feedback on one of these treatments that you may have had done. And if you want to share your experience, that'd be great. And again, subscribe, share with friends. We really appreciate you listening and watching, but make sure you subscribe at the same time so we can get this information out to more ladies. So
absolutely.
We're here to revitalize your look, your health, and your sex life. Thank you.